getting vaccinated, but it helps protect infants who are too young to be vaccinated yet, people who are undergoing cancer treatment, transplant recipients, others whose immune systems may not be able to fight off the disease. If you're unsure if your child has up to date on their vaccine or yourself, check with your healthcare provider. Staying current on recommended vaccines is it's the most important thing you can do to help protect your family and our community. So over the next 6 weeks, you're going to see educational messages from the Delaware County Health Department across our website, across social media and community settings. We encourage all of you, please share this information with your family and friends. Together, we can increase awareness, improve vaccination rates, and help prevent measles from causing harm in our community. Thank you. And I'd like to introduce Dr. Monica Taylor from County Council for a few remarks. Thank you.
Thank you, Laura, and good afternoon or good morning, everyone. Hello, I'm Delaware County Council Member Dr. Monica Taylor, and I'm really thankful to be here with all of you today. As some may know, measles infections are on the rise across the country, especially here in Pennsylvania. Delco is more prepared than ever to give our residents the resources they need to keep themselves and their loved ones safe. Some history on DCHD is helpful to understand how we're prepared to meet this moment. In the wake of the COVID-19 pandemic, the county's health department was formed to provide residents with public health leadership and become better prepared for future potential population health threats. Under the leadership of Laura Warner, her staff, and the extremely helpful team that makes up our DCHD, I'm proud to say we are prepared. I'm proud to be a part of a council that understands the need to prioritize the health of Delco, and that's exactly what this initiative is here to do. Measles is a highly contagious, dangerous disease that can lead to serious issues, especially in children. But it is preventable through vaccination, which our health department is providing to children all across Delco as part of their back-to-school campaign to keep our community healthier. This vaccination campaign reflects the county's shared commitment to meeting residents where they are, delivering resources, and ensuring the safety of Delco for generations to come. We as a county have banded together to help one another time and time again. Getting vaccinated, protecting our neighbors, and lessening the burden on our healthcare professionals is a foolproof way to be a good citizen. Again, the spread of measles can be prevented. We've done it before, and we can do it again. Please consult with your physician, reach out to our health department, and do what you can to keep you and your loved ones safe. If you fall within the risk factors for measles, please get vaccinated. Thank you, everyone. I'll turn it back over to Director Warner.
Do we have any of the Spanish-speaking channels here? I don't think so, right? So we were going to do translation. Oh, we do. Oh, so I'd like to introduce Taimani, who will give our remarks in Spanish. Thank you. Thank you, Taimani. Hello.
Sorry. Buenos días, mi nombre es Taimani, estoy trabajando con el Departamento de Salud y estamos hablando hoy del sarampión, que se llama los measles. No vacunarse en contra del sarampión tiene a nuestra comunidad a riesgo y I'm sorry, I gotta start over. Nerves. Okay. Sorry. Should I start? Okay. I'm sorry. Mi nombre es Taimani Rivera, Taimani Rivera Hall, perdona. Estoy hablando sobre los measles, que se llama el sarampión. No vacunarse contra el sarampión tiene a nuestra comunidad a riesgo de contraer al sarampión. El Departamento de Salud de Pensilvania tiene confirmado desde enero hasta julio 24, 139 casos del sarampión en Pensilvania. El sarampión es muy contagioso y se transmite por las vías respiratorias. Una persona infectada puede transmitir la enfermedad hasta 18 personas más. El sarampión se transmite por estornudar, toser o hablar frente de una persona que tenga el sarampión. El sarampión es algo muy serio que puede ocasionar complicaciones y visitas al hospital. En este momento, el Departamento de Salud quisiera que usted se eduque y también busque la vacuna para su niño para que pueda coger cuando ellos vayan para atrás para la escuela y probarle que ellos no estén enfermos con el sarampión. Gracias.
We do have some families here that are very kind. They've been willing to come here for our event, so thank you, to get their vaccines. But we can take any questions if you want first, or if you want to just move into visuals, it's all good.
For the elderly that may have some questions about vaccines and things like that, what's your message to them?
Well, definitely call us. We'll talk you through anything. Our wellness line at the health department's available, 484-276-2100 for questions. If you were born before, I think it's 1957, you're generally considered that you've been exposed to measles. But if you had a vaccine before 1968, I think the effectiveness can wane. So we do like to talk to people about what their individual situation is.
What ages for kids can they start getting this, getting the vaccine?
I'm going to turn that over to my nurses to talk about that.
So good question. So what age can kids start getting the vaccine? So starting at age 1, you can get your first dose, and then you get a booster at 4 to 6 years. You can get it the first dose if you need to, and within 4 weeks get the second dose, but they usually wait till that 4-year-old well check to do that second booster.
What other vaccinations are offered on the mobile clinics, especially for kids, and what other health concerns are you looking at in terms of when the school year comes around and kids go back to school?
Yeah, so we can offer all of the recommended vaccines on our mobile health unit. We have the Vaccines for Children program. It's called VFC. It's a state and federal program where we are able to vaccinate kids that don't have insurance, they're underinsured, they have Medicaid, and it's great. So we can offer them all the school required vaccines plus any of the recommended vaccines like hepatitis A, HPV, and then as far as like other concerns that we look out for, we encourage our school nurses to let us know if there's families that need vaccines. We work really closely with different school districts, and we're able to go on site to their schools, vaccinate kids during the day. So it's just kind of based on the needs of the different areas, and if there's a low rate of Tdap or meningitis for our 7th and 12th graders, we can go and help them get vaccinated.
Does that address the gap? Like, are some families finding it difficult to get to their primary care pediatricians or even a mobile health clinic, where if you go into the schools, it's kind of that?
Yeah, so there's a lot of things. You have barriers with transportation. You have families that, if they take off work, they don't get paid. So we can pre-consent kids before we go into the schools. And then once we're there, we can do it during the school day. The parents don't have to be there. This works better for our older kids, but yeah, that kind of breaks down that barrier with transportation and time, so.
Can you, just for reporters and everybody on tape, can you spell first name and last name and give your title?
Sure. You want to go ahead?
For both of us?
Yeah, please.
Okay, so Laura Werner, LORAWERNER. I'm the director of the Delaware County Health Department.
And my name's Megan, MEAGAN. Last name Sheikh, SHEIKH. And I'm the administrator of personal health here at the health department.
Anybody else?
How many, talk about numbers, like what can this vehicle do, and what are your goals for number-wise?
We just brought this into operation in June, so we're really piloting some of the work that we're doing with it now. I mean, I think we've got, you said 50 vaccines on board now, right? I think. But, it really will depend on the flow of what we're doing and how many folks and families that we're seeing, so that'll vary. So.
Will the location vary as well?
Yes, and that's programming is definitely under development right now. We're going to be actually allowing community partners to reach out to us on our website and say that they would like to have a mobile unit to come to an event in their community. So that'll start next week. We're going to have that access going live. We will be working on both a combination of events where or schedules where we keep a regular presence and also ad hoc special events.
And we can find that out through the website?
Yes. Okay. Great. Thank you very much. Okay.
So just as a heads up for everybody, these two wonderful families have agreed to be vaccinated on camera, but they have asked to protect their privacy that we do not show faces. So we're just asking everybody here to please.